Hi there, welcome to Family Doctor Expert. Today we're going to talk about diabetes. So what is diabetes? It is when you have too much sugar in your blood. It's a really common problem. In fact, in the world there's about 400 million people with diabetes, and in Australia it's probably more than 5% of people. So there's a couple of different types of diabetes. Type 1 and type 2. Very creatively named. There's actually a few others as well, but we won't worry about them for now. Type 1 is caused by the immune system attacking a little gland in your tummy called the pancreas, which makes insulin. And then it can't make insulin anymore, and so your sugar can't get from your blood into your muscles. So people with type 1 diabetes usually have insulin injections. And then there's type 2, which is the more common one. About 90% of people with diabetes. A bit more of a lifestyle story with the causation. Much more to do with lack of exercise, poor diet, obesity, overweight, more in that territory. And that's a really common one that's growing in countries like Australia and the rich and poor countries all around the world. So, diabetes, why do we care about it? Who cares if your sugar's a bit high? Well, a few things. First of all, people get symptoms from it. So often they'll come in with weeing a lot, drinking a lot, thirsty, hungry, tiredness, or sometimes they just might have a cut or an infection that just won't heal. So these are very common symptoms that make us think about diabetes. But here's the thing, some people don't get any symptoms at all. And so about 50% of people walking around the community don't actually realise they've got diabetes. And this is not great because diabetes is associated with quite a lot of long-term complications. So we really want to know if someone's got it because there's a whole lot of things we can do to prevent those complications. So what are the complications of diabetes? Well, increased risk of heart attacks, increased risk of strokes, problems with the kidneys, problems with the little vessels at the back of the eyes. So that's just to name a few of the issues. And some people get problems with their feet, they lose some of their sensation and they get ulcers and all sorts of trouble. So we really want to head that off. So if you've got diabetes, it's very important to have a good GP and usually to get a team of people that are helping manage the diabetes. This can include a diabetes educator, often a dietitian, sometimes an endocrinologist who's a specialist in diabetes and other hormone problems. And getting the team right, I think, is really important because with diabetes, we like to get the management spot on, and also there's a whole lot of things we like to measure regularly to just check that we're doing well. So let's talk about what we measure. So a lot of people with diabetes will do what we call blood sugar measurements. So you might have seen them, they have like a little needle where they take a drop of blood from their finger and put it on a machine. Blood glucose monitoring, it will tell us what blood sugar levels they have. This is very important for people who've got type 1 diabetes because they've got to work out how much insulin to give themselves. But it's also useful for people with type 2 diabetes to see how they go. Other things we like to measure, everyone with diabetes once a year should definitely get their eyes checked at the optometrist or an ophthalmologist. They have a look at the back of your eyes, make sure that the little blood vessels there aren't causing any problems. And the good thing is if they do happen to notice any problems, there's lots that we can do about it. Similarly, it's good to check your feet at least once a year. Sometimes with a podiatrist is very useful, making sure that your nails are cut and also that there's no cuts or ulcers that need to be addressed. So that's very important as well. Doing a urine test is important to make sure that the kidneys are happy, and a regular blood test to measure a number of things, but particularly an important blood test we call the HbA1c. It sounds like a little science fiction thing, but the HbA1c gives us a 3-month measurement of how your sugar levels are going. So it's very valuable to look at how well the diabetes is being controlled. So amongst all these measures, what can you do? Well, there's a whole lot of lifestyle things you can do. Losing weight is very helpful, especially losing weight around the waist seems to be very important. Managing any blood pressure problems is very important. Not smoking. Smoking and diabetes, shocking combination. Very high risk of complications. So really, if you do happen to have diabetes, smoking is got to go. Talk about it with your doctor. Exercise, and preferably half an hour every day. Can be walking, can be riding, doing something where you are exercising. Very helpful for glucose control and helps to reduce some of the complications. Now, there's a whole range of medications. Some of them are just tablets, what we call the oral hypoglycaemics. So tablets that make sugar go down. And there's a whole discussion about those, which we'll put on another video. Some people with type 2 diabetes eventually go on to need insulin, and many people with type 1 diabetes will use insulin injections right from when they've had the diagnosis. So this is a very important discussion with your doctor about what medications you should use. And there are lots of new medications coming online all the time, so it's worth keeping an eye on that. In Australia and a lot of other countries, we have a national system which subsidises the cost of all diabetes medications and blood glucose monitors and all of that. So you should talk to your doctor, because if you register with that system, a lot of the costs of the medications and things will be covered. So we could talk about diabetes for hours. There's lots and lots to know about it. And I recommend, if you've been diagnosed with it, get educated about it. Find out as much as you can so that you can manage it well. As usual, this video is just a general guide. These family doctor expert videos are just a guide, and you should always speak to your doctor first and not make any decisions just based on this video. Anyway, I hope that's given you a general outline about what diabetes is, what can be done about it. If it's picked up early, that's the first thing, because a whole lot of people don't know they've got it, and you manage it well, you can drastically reduce the complications. So that's good news. So I wish you all the best from Family Doctor Expert.